I just really enjoyed reading the article. So
No, thank you for reaching out. It's it feels quite an honor that you've taken the effort to read through the article in detail and actually reach out. So thank you.
I think it's in the latest issue of Journal of Psychotherapy Integration, right?
Yes, I believe so too. No, that's right.
Okay, so this is psychotherapy integration training around the globe, a personal and empirical perspective. And, first thing I just wanted to ask is, how did this study come about?
Yeah, that's at least for me quite. It's been quite an interesting process. It all started in Dublin at a SEPI conference a few years ago, and there was a panel on training and a few people that sort of were hanging around afterwards and talking. And then there was this dinner, I remember, with a lot of awful Irish music and a lot of dancing and things. But that was a time where a few of us junior clinicians sort of ended up talking a lot about training and how we were sort of frustrated with the fact that we weren't actually trained properly in how to integrate psychotherapy, and that we were sort of curious of what is effective training and integration, and are we just missing it? Is it just us, or is this a bigger problem? And so from then on we started to sort of go back and forth in emails afterwards, and this was mainly Domenica from Argentina and Marketa from the Czech Republic. So it was sort of really interesting to hear about the different cultural perspectives and see what it was like and what it was like for them, and how we could compare and contrast our experiences. So that's really how it started. Just a coffee at a conference, and then a crazy dinner party, and that's where it started.
Awesome. That's what we have conferences for.
Exactly.
Cool. Okay, so this is very interesting. So you came into it kind of also from your own experience as a trainee and being a little bit frustrated about how you were trained integratively, or what did it even mean to be trained integratively.
Exactly. Yeah, definitely my experience, both in the Netherlands and in the UK, there was a lot of focus on learning a particular manual, particular model, and it was sort of implicitly assumed that you would integrate all the knowledge that you were learning in your clinical, like your internships, your placements. But there was actually no supervisor who was focusing on that. Like there was a supervisor expert in a particular the CBT model or psychodynamic model, which is all super relevant and interesting, and you can learn a lot. But I was left with the question: so how do I make sense of this? How can I integrate these different ways of working?
So in the paper, at least one of the parts focus on 4 different countries. So it's the United States, United Kingdom, Czech Republic, and Argentina.
Yes.
And as you were saying, when we think about more established models, like specific models, I would assume that if you're doing a CBT training in any of these countries, at least some of it would overlap. And I'm kind of curious, when you started talking with your colleagues, how much did it overlap when people started talking about being trained integratively?
Right. I thought there wasn't that much overlap at all. It seemed like in the Czech Republic, because there's no controlled title for a psychotherapist or clinical psychologist, it was actually that most people practice as an integrative therapist, and that was the norm, although it wasn't formalized in any way. And in Argentina, it was historically more psychoanalytic, and then some more CBT came in recently. And there are some formal training sessions, like postgraduate and graduate training settings, where you can focus on integration specifically. Whereas my experience in the UK was, I don't even recall the term that it was actually used. So it was really being trained in particular models. And in hindsight, I could say, okay, some third wave CBT models were integrative models, but I wasn't really supported in developing that.
So this is already the first issue. Like, what do we mean when we say in an integrative training? And so kind of what I'm hearing is that even that is a very hard thing to define.
Exactly. I think so, and I think even now, if you would go to CEPI conference in Lisbon in the summer, then that would still be a topic of discussion what it actually is, right? Are we supposed to integrate techniques or theories or different approaches? It's not that simple.
So when you were doing this paper, what did you discover in terms of the existing trainings around the world that you think stand out as integrative trainings?
Well, actually, what stood out is that the only papers that we found there were 9 empirical studies, which is quite embarrassing if you think about.
We only need 2 hands.
Exactly. It's really nothing. And it was very different. So some studies first implemented a module on integration, and then introduced different theories and different techniques, whereas some other studies actually did the opposite, and first making people competent in a particular model and then saying, hey, but actually you can integrate it. And then there were some survey studies that asked directors of training what they thought they did. So really, if you think about the fact that there are only 9 studies, and then even then they were so different, like what can we say? So actually my conclusion would be there isn't much evidence at all to say what is effective. So we know from a few examples, and Argentina I think is a nice example there, is that there is actually formal training, and also in the Czech Republic there is a training. There are graduate trainings for it. But if we think about the UK and the US, it seems to be more different. Schools might have a different course, or particular course, or particular supervisor pays attention to it. But that seems to be about it, at least empirically. Maybe people do a lot, but they just don't write it up or they don't evaluate it. That's possible.
So I love tables, and you have a very nice table in your paper, kind of laying out the papers you found. And
right.
Something very interesting that I noted there is that you also classify broadly which type of integration was being trained. So if it was more assimilative, more theoretical, what did you learn for this? Were there any trends in any way?
I would argue with a sample of 9, we can't speak about any trends, really.
Sure.
So I think it's helpful for us to have such a table as in a starting point to know what we already know, but we need triple, 4 times, 5 times as much to actually say, is there a particular trend of something that might be effective? Because at the moment I don't know all those people who do clinical training and integration, or there might be training institutes or professors who will really take this seriously but actually don't evaluate it. So I feel like that's actually where we should make sure we communicate more, and we make this an evidence-based training rather than just something that we do in practice and we don't measure.
And so in terms of I'm happy you're touching on that. So in terms of the evidence itself, so we established there are very few papers. And in terms of the quality, methodological quality of these papers, was there also like a lot of discrepancy?
There were pretty small samples, I would argue, and different measures, a lot of open questions to students and to directors of training. So it's quite hard to analyze in that sense. It would be ideal to have more robust studies, and then you can actually do a meta-analysis or something a little bit more structured and robust.
So it sounds like you kind of came out of the experience thinking, oh my God, there's so little.
Right, exactly. Yes, I thought so. We were all junior clinicians and all wanting to be a scientist practitioner, right? So one of the things that if clinically you're not really sure, if you go to the science and you think, okay, maybe the empirical literature will help me. And I'm not sure it really did, as in, apart from saying, like, we need more, like, this is really untapped territory, and that was really surprising, I guess, for the importance of integration. And I think, I mean, even now when I'm teaching as a professor at Yeshiva University, and their students ask me all the time, so how am I supposed to make sense of your psychodynamic course when I also get taught about cognitive therapy, and how can I integrate that when I see clients? And
right.
So I think it's on most clinicians' minds of how to make sense of all that they learn.
And were you able, going through these papers, to also at least get a feel for what trainees valued in terms of in training integratively?
Yeah, my understanding, which was surprising to me, is that they actually would value starting with training on integration first. So more on common factors or general psychotherapy skills and what that might look like before going into depth into a particular model.
Mm-hmm.
Whereas the training directors actually said the opposite and said, no, actually it's really important to know, for students to know a particular model well, and then they should integrate later.
Do you have any idea why this discrepancy might be happening?
I don't know. I was expecting something different because in my mind, like as a clinician in training, I'm more anxious, and I want to hold on to a particular way of working, so that at least I know that I'm doing well, or I'm doing what I'm supposed to be doing.
Right.
And in that sense, integration is far more anxiety provoking because it's not so structured. But I mean, thinking at least from the US system, where some people who start graduate training in clinical psychology might not have any clinical experience at all, it sort of makes sense that you first want to get an idea of what psychotherapy might look like, whether it's, especially when it's flawed or not perfect, and then learn more about the particular models to understand those better.
Yeah. Did doing this research change in any way the way you viewed optimal integrative training? Like, did it in some way influence your thinking of, well, it could be interesting then to think of integrative training as something more like this?
I think how it has changed my my teaching. I'm teaching evidence-based psychodynamic therapy at Yeshiva, and I think before I wrote this paper, I was very clear on making the point that it was psychoanalytic concepts that we were trying to translate into different therapies, and I was introducing them to different models, but really underlining the psychoanalytic elements. Whereas now I'm saying, okay, so what does this look like? What other kind of therapies do something similar? They might call it different, or what is the overlap, and how might you use this even if you were to treat your patient with a CBT model? So I'm definitely discussing those clinical implications more. So I'm no longer sitting on my high horse to say it all needs to be psychoanalytic. It's actually in real life practice, when you have a patient that you don't work psychodynamically with, what could you use?
Right. So any recommendations for possible teachers or researchers hearing this, interested in integration?
Right. But I would hope, and maybe that's easier to change than the whole system, but that supervisors would pay attention to the complication of integration. So I know a lot of supervisors are asked to just supervise a particular model or particular approach, but actually to brainstorm and wonder with the trainee, like, how could we integrate this, or how might you integrate something else? And the same with courses, to try to brainstorm how you might work with this patient if you were to use a different model, or how much you used two different models together, or to make this far more explicit. I think at the moment it feels like an implicit journey that we're just assumed to make sense of.
Right.
But yeah, for supervisors, for training directors, for teachers to all make it far more explicit.
And
Yeah.
just going now to the other side, to the Katie side, who was also frustrated with her own training. What, for someone who's starting out, as being interested in integration, but it's kind of a jungle where you don't know what to do with it. Do you have, if a student comes to you interested in this, do you have any, like, I don't know, pet book or articles or whatever that you kind of always go back to in recommending?
It's funny because I haven't been recommending books or articles. I've been recommending going to the CEPI conference, actually, to see different perspectives together in an atmosphere where you don't judge, or you're just excited to hear about different ways of working.
Mm-hmm. Mm-hmm.
And to see the clinician perspective of that, which I think CEPI offers really well. Mm-hmm. So that's I think what I've been recommending, really. And also there's no level of competency or like, now I've achieved it. It's a continuous growth.
And like other schools? Are you contrasting this? I'm not sure.
I mean, I don't know. I guess in my view, psychoanalytic therapy is also a developmental process,
right?
Until you die. But maybe in CBT or some other shorter term models, you would say, okay, now I'm competent. Now I know what I'm doing. This is what I do, and this is done. Whereas I would say integration is never done.
Right.
There's always more to contemplate and to wonder about, and that makes it so interesting and relevant, I think.
Mm-hmm, mm-hmm. Well, this is wonderful, Katie. Thank you so much for this opportunity. Like, I'm, of course, also having this talk with you because I want to encourage people to go and read the paper, and I guess encourage people to do more of these papers because we need them badly.
Exactly, we do. No, thank you for reading it and for paying attention to it. I appreciate that.